This is our COVID Roundup and CDC update for June 7th, 2024. Since last week, we've had no changes in deaths due to COVID. Putting this into context, 5 out of the last 6 weeks have been constant in COVID deaths. Moving on to the genetic surveillance program by the CDC, we see that the COVID variants are diversifying, where there are many different subvariants out there right now. When we looked at these variants in proportion, KP3 is sitting at about 25%, KP2 at 22.5%, and LB1 at 14.9%. In contrast, this is what it looked like 2 weeks ago, where KP2 was sitting at about 29% in proportion, KP3 at about 13%, and LB1 wasn't even on the list. So at this current time, KP2 is heading down. It dropped by about 6% in proportion to other variants. LB1 seems to have a huge growth advantage. It went from not registering to being about 15% in proportion, and KP3 also had a giant spike from about 13% to 25%. And I want to emphasize that simply by following the COVID literature over these past few roundups, we were literally able to predict that this is going to happen. When we look over to Raj's COVID variant tracking, we see a similar trend where LB1 has had quite a rise, but of note, KP3 has made many subvariants, which now make up greater than 1% of the population of variants, which may possibly indicate that KP3 will be the next major branch. And before I forget, JN1 is well on its way out. It dropped from about 8% in proportion to the other variants to about 3%. This is confirmed by both Raj's tracker and by the CDC tracker. When we look to the CDC travel surveillance program, we have another stark reduction of data. For a little historical look back, at the beginning of the pandemic, we had all-time surveillance of variants. This meant we were able to see from the start of the travel monitoring program all the way to the current time, all the variants in circulation. Towards the end of the public health emergency, they sparsed this data down to just about a year view, meaning that we lost our ability to see the full picture, and then the data was reduced once more as of this week, giving only about a 5 to 6 month view, demonstrating once more that the CDC is continuing to erode our ability to surveil COVID. Moving on to our New York State wastewater surveillance map. As a reminder, anything that's dark blue is low levels of COVID in the wastewater, anything that's light blue is moderate, and anything from yellow to bright red is high levels of COVID in the wastewater. Since last week, New York has seen modest declines in the wastewater data, dropping from about 63% reporting at the highest levels to now about 53%. Finally, moving over to wastewater scan and looking at California, we are still seeing clear increases in the COVID wastewater levels. Here it is blown up, where we're heading straight up. Now let's compare this to prior summer waves. We're currently sitting just about a quarter of the way through our summer wave on a typical duration timescale, where I've boxed out the 4 summer waves in wastewater scan. And despite this, we're already nearing peaks of past summer waves. Next, looking to all of wastewater scan, we are seeing a similar thing with very sharp increases currently, where, as a reminder, increasing wastewater concentrations of COVID is increasing COVID cases. And when we do a similar boxing of the past summer waves for all of wastewater scan, we see that we've already reached absolute peaks of past summer waves, which likely indicates this is going to be our highest summer wave yet. And by highest, I mean highest levels of COVID in the wastewater. And when we look to our Iowa tracker, our top 5 states based on viral activity from COVID in the wastewater is Hawaii, Wyoming, Utah, New Mexico, and Nevada.